Hello guys, in this video we will be simplifying the Glasgow comma scale. So many of you find it difficult to remember. So what comes under the scoring? So in I what parameter come, in verbal what parameter come, and in motor what parameter come, and also this may be a 4 marker question in your university exam. So let's simplify Glasgow comma scale. So first of all, Glasgow comma scale. See, we have three components. So the mnemonic is EVM, that is your voting machine, electronic voting machine. I, verbal, and motor. See, I has three letters. In each of the following, add one as the maximum response. Means maximum response will be 4. Okay, verb. Don't consider the word verbal, it is verb, that is 4 letter, means maximum response would be 5. Motor, it's 5 letters, so the maximum response would be the 6th one. Okay, now coming on to the I opening response. See, we have three parameter, I, verbal, and motor, and we need to grade it. So see, I, the maximum score is 4 if you check it out. Verb 4 letter, that is maximum score is 5. Motor 5 letter, so the maximum score is 6. I think you can see the maximum score. So now we need to grade the score. See, if you count the maximum score, guys, what will be the maximum score if you count? Maximum will be, guys, 6 plus 5 plus 4, that counts to 15. And minimum, guys, 1 you see minimum in each of the three, guys, that is minimum score is 3. So the score varies between 3 to 15. So what is the use of this Glasgow comma scale? Suppose a patient presents to you in your emergency department with a history of trauma or some brain injury. So you need to know, you need to assess what is the condition. So then we go for Glasgow comma scale. So see, how do you grade the Glasgow comma scale? If it is 13 to 15, guys, that is mild injury, guys. Let most often like normal. Moderate if the score is 9 to 12, and severe if the score is 3 to 8. So this was developed to assess the level of neurological injuries, guys, and this was discovered in 1974. So now how to remember the response for C? I maximum is 4. So remember, how do you see, we'll go to the next one, guys. See, this is already done, guys. See, so how do you remember the I wala parameter, guys? Okay, so remember like this. So how do you dream, guys? We dream with our eyes open, guys. Okay, and when you dream in Hindi, it's known as sapna. Okay, so remember sapna. Okay, that is S means spontaneous, V means voice, P means pain, and N means no response. We'll further go to the table, guys. Now if we talk about the verb, that is 4 letters, so maximum response would be 5. So the mnemonic is there, means his verb means speaking, guys. Best verbal response, where is he able to speak or not. So the mnemonic is no sound should come out. Okay, that is no response is 1. Okay, sound is 2, then would is 3, come is confused, inappropriate word, C is confused, and O is oriented, guys. Okay, or also you can try this mnemonic, guys. This is also good mnemonic. Our country win. Okay, if you try this mnemonic, so how can you remember it? When our country win, we shout. Okay, so O means oriented, C means confused, W means words inappropriate, I means incomprehensible sounds, N means no response. I think both of the mnemonics, whichever suits you, guys, you can try remembering it. Both are good. Now coming on to the motor response. Motor is 5 letters, so the maximum response would be 6. So the mnemonic is, remember the mnemonic, old Ben. Okay, OLDBN. So now old man, O means obeys command, L means localized to pain, D means draws away from pain, withdraws from pain, B means bends, bend also known as the flexion, E means extension. Okay, then N means no response. Now there is a very big confusion, guys. Okay, what is decerebrate and what is decorticate? I think this is one of the most confusing topics starting from your first year when you read it for the first time. So in which one you have extension posture and which one you have flexion posture. So if you see the word, guys, decerebrate, guys, if you see, there are more number of E's, guys, means this has the extended posture. Remember like this, guys. And this, so this decorticate will have the flexion wala. See, abnormal flexion is decorticate, extension means decerebrate. Now if you check out, guys, this figure is not simply given like this. If you see, guys, this is the level of red nucleus. Okay, so decorticate, what you see, the lesion is above the red nucleus, and say decorticate OR means the lesion is above the red nucleus. This also helps you coordinate with your physio. And Decerebrate will be BR, that is below the red nucleus, guys. So I think this helps you simplify. Now coming on to this table, guys, we'll see. Now if we see I, so we'll remember I means sapna dekhna, that is swapna. S is spontaneous. See, check it out along with me, guys. I think this will help you more. S means spontaneous, guys. Then after that SVP, and then V is voice, guys, that is speech. You can also remember it like voice, right? Same thing, guys. P means pain, guys. N means no response. Now coming on to the word wala. So maximum response would be 5. When do you shout, girls? When your country win. So our country win. O means oriented. Okay. Then C means confused. Okay. Then after this C is confused, then W means inappropriate word. I means incomprehensible sound, and N means no response. Okay, and if you see now motor 5 letters, so maximum response would be 6, that is OLDBEN. O means obeys command. L means localizes to pain. D means draws away from pain. B means bends, that is flexion, and it is flexion. And E means extension. So mode of E, which letter is, guys? Decerebrate. So abnormal extension is decerebrate, while abnormal flexion is decorticate. And N means no response. And this is the grading of the Glasgow comma scale. I think, guys, this helps you remember the mnemonic for Glasgow comma scale. Just we have 3 mnemonics: Swapn, our country win, and guys, the third mnemonic is, that is OLDBEN. So so just, guys, try practicing the question on this, and I think this will help you remember. You can easily recall in your exam or your MCQ. If you like the content, guys, do subscribe to the channel, comment, and join the Telegram channel for the PDF notes. Happy learning, guys.